All right, welcome everybody. We're gonna just hold on here for a second while everybody trickles in from the waiting room now that we've started. Then I'll introduce everybody and we'll let Dr. Rittenberg take it away. Okay, I'm gonna go ahead and get started. My name's Corey. I'm a member of the Pacific Cup Board. I've been arranging a lot of these educational events like the POAs and this seminar as well. So I hope you guys have all been learning a lot from them. We also have Bob Hendon here, who is on the board, but also is representing the technical committee, who is working with Dr. Rittenberg and GWU to figure out the best way for the Pacific Cup to interact and make use and keep everybody safe of using the GWU services. And finally, the star of the night, Dr. Adam Rittenberg here from GWU. He did this seminar 2 years ago and did a really awesome job. So I'm sure that he's gonna give you all the same good information plus whatever we've all learned in 2 years. The GWU service, for those of you who don't know, I think Dr. Rittenberg will tell you more, but it's free to all of our racers to use while they're sailing to Hawaii. And it's, I think, a really unique thing that we offer as part of the Pacific Cup. Something that I've been on Transpac and wish that we had access to something similar when we had a member of our crew get injured. So, this is a great chance to learn how to use it and how to stay safe, whether or not you do call them. So anyway, take it away, Dr. Rittenberg.
Okay, thanks for the intro, Corey. I appreciate it. Here, let me just share my screen here so I can get some slides up. All right, can everyone, Corey, just give me, or Bob, just give me a thumbs up if you can see this. Okay, perfect. So I'm Adam Rittenberg. I'm an emergency physician at George Washington University, and that's sort of my day job. But then my sort of side job, which is also at GW, is to help run our Maritime Medical Access Program. And we're again coming back to you this summer to provide service. We've done this in the past, actually, for many years in the past for your race as well as some others. So let me just start and give you a little bit of background information. And if you've, as Corey said, if you've done this before, some of this will be old to you, but I have made some additions to this presentation. And actually, I'm happy to say some subtractions. I've actually removed the slides specific to COVID-19. Although there is still some threat to that, it's certainly not looming as large as it was 2 years ago. So first of all, who am I? I'm an emergency physician. First, I'm board certified. I work at George Washington University Hospital, and our practice also covers the DCVA Medical Center. So I work in the emergency department at the DCVA. And then I'm also very heavily involved in our telemedicine programs here at GW. We have a 24/7 call center, which provides, in addition to maritime medicine, other types of telemedicine access as well. I'm the quality improvement director for Maritime Medical Access, and I'm also a tall ship sailor. So I always like to put a little plug in here. This is me. The picture's getting a little old now, but I'm standing on the yard of the Kalmar Nickel, which is the state tall ship of Delaware. Been sailing Sunfish since I was about 5 or 6 years old. Most of our physicians at Maritime Medical Access either have some professional or personal history with sailing, or else in other aspects of the maritime industry. So that brings me to us. Who are we, for those who don't know? GW Maritime Medical Access has been around since 1989. It was really one of the first programs of its kind, and probably still one of the biggest and most comprehensive. We provide 24/7, 365 medical advice to vessels, aircraft, and remote locations around the world. So we cover basically all aspects of the maritime industry. So shipping, fishing boats, cruise vessels, research vessels, some cruise lines. We also cover some government teams. And then we've gotten in recent years into terrestrial-based remote medicine. So we cover Antarctic research stations, basically anywhere where people might be far from medical assistance for a long period of time. All of our physicians are board certified, practicing, academic. We kind of throw in the word academic there because we're a teaching hospital and a university and a medical school. emergency physicians, and we provide medical, logistical, and operational support to people who have illnesses and injuries in these remote locations. Who are we connected to? So as I sort of alluded to, we are the Maritime Group is a small group within a much larger emergency department, or Department of Emergency Medicine, and then there are concentric circles that expand further. So we are within a very large multi-specialty university-based physician practice. And so there are instances where we need the expertise of some of our colleagues, for example, in dermatology or orthopedics. But because we work in an emergency department, we're sort of uniquely set up to handle the motto of emergency medicine is any patient, anywhere, anytime. And so we can handle most things on our own, but sometimes we do need some additional subspecialist assistance. So we have that capability as well. We were the 7th academic emergency department in the United States. Our current chairman actually has been the chairman for decades, and has been at GW since the early 80s. So why am I here? So the reason I'm talking to you all right now, and the reason I'm here, is because when you're out sailing, I am not going to be able to be here. So this is perhaps, the worst possible place to have an injury or an illness. And you're in this location or in this situation, you can really potentially be days or weeks from definitive care. And so our goal is to be here for you to contact us, to try to bring some of that expertise and assistance to you wherever you are, and hopefully manage what we can on board. And if it turns out that an illness or an injury is beyond the capabilities to be managed on board, then we work with other resources, the Pacific Cup, the Coast Guard, other assets that are out there to try to work out a care plan and get you to the place where you need to be to make sure that you're safe and taken care of. Brief outline, I'm going to talk a little bit about preparation. I'm going to talk about telemedicine at sea, and then I'm going to talk a little bit about medicines and equipment that you would have with you while you're out on your race. So let's start with preparation. So this actually, in many ways, this is actually one of the most important, or the most important part of this discussion. Before anyone goes out to sea, so, captain, crew, anyone, you really have to make sure that you are fit for sea, fit for duty, and that you personally are in a good place to avoid having an illness while you're at sea, or to avoid having an injury as well. So, we need to think about things like balance, strength, how capable are we to undergo and to sort of participate in the activities that are involved. Actually, I just want to pause real quick. I noticed that there's a question in the Q&A. I'm going to take a look at it real quick, but to keep this going, I'll try to pause and talk about some of the questions, but we might have to wait and just save some of them to the end. And I'm going to address the question is, how should we pre-plan with you for crew with pre-existing medical conditions? And I'm actually going to talk about that in a minute. So most important thing is see your doctor before you go offshore. So a lot of physicians might not necessarily understand what you're going to go through or how far you might be. And so it's important to discuss the nature of your voyage with them. This is sort of a generic statement, right? Sometimes people might only be sailing for a day or two, or only be 12 hours offshore. But discuss the nature of your voyage, really undergo a complete physical, have lab work done. Get an EKG. That's actually something that's very important for people to just have in general at baseline, a baseline EKG, either on their phone or a paper copy. Talk about any vaccines that you might need. So this is going to be less relevant here, but in general, when you're sailing, if you go anywhere where there might be tropical diseases that you need to be vaccinated against, that's important. In this case, I'm actually going to mention COVID-19 here. I still strongly recommend that people get a COVID-19 shot, even though COVID is not as prevalent as it was 2 years ago, and the cases that we're seeing are not as severe. We are still seeing some people get very sick with COVID. And even if it might not cause you to be, hypoxic or need a ventilator, You really don't want to be in a situation where you're offshore, double handing, and one of you goes down with, 103 fever, or, both of you. That's something that's avoidable. The other thing is medication reconciliation and refill. So reconciliation really means that you go over all of your medications with your doctor to make sure that you're on the medicines that you need to be on, but are not on the medicines that you don't need to be on. Sometimes when we go through medication lists, we find that people are on medications that are duplicative or that are no longer needed. And there are potential side effects and harms to that. So really making sure that you're on the right meds and then having the medications that you need. We always recommend that people have basically enough medication to cover the full course of their voyage, plus at least anywhere from 10 to 25% more, depending on the voyage, to make sure that they have enough to manage any contingencies if there's if they have to divert or if their plans changed. The other thing is, get that rash. I say this all the time, get that rash, lump, or other nagging issue checked out. A minor pain in the belly. Unfortunately, I have stories where people have a minor pain in the belly, or there's a small rash on the arm. They think it's nothing, and then it kind of blows up and becomes a major issue once they're offshore. So it's really important, even if you think that you have a minor issue, to discuss it with your doctor. The other thing, and I actually have a full slide on this later, is see any specialists who take care of you, but also see your dentist. I think this is something that a lot of people leave behind or don't really think about. And one thing that people are often surprised about is there's a very large percentage of our calls for service in general across our whole practice are actually for dental issues, like dental infections. So get dental work checked out, make sure you have a cleaning, make sure that you're in good dental health. Next point. So in preparation for your voyage, now this speaks a little bit to that question that was put in the chat about how we prepare for people with pre-existing conditions. So much like we sort of think of ourselves as a medical practice, and much like any other medical practice, we don't pre-collect information about everyone who might potentially be one of our patients. So at any one time, we're covering hundreds and hundreds of ships, and there can be thousands and thousands of individuals on those ships. So we actually ask that people don't send us information, and we don't want to create a medical record or a medical chart and pre-track all of this information. But just as you would if you go to see your doctor or a new doctor, we like to make sure that when we do an intake, when we have a case, we're able to get all of the relevant medical background information, ideally quickly and easily. So what we recommend is that everyone on board have a medical summary for each member of the crew. This is something I'm going to actually kind of jump to the end of the slide here, but it should include basically the name, date of birth, medical problems, list of prior surgeries or procedures, medication lists, medical allergies, a copy of that all-important EKG, and then the names and contact information for all of the physicians that you might see. The reason we like to have the latter is because sometimes people will come to us with an acute issue related to a complex chronic issue that's already being managed by a physician ashore somewhere. And we like to be able to contact those physicians to get a little bit of history on how that treatment has gone, or what treatment has been done previously. And what we recommend in these cases is that it be kept on paper, laminated, ideally single sheet, but it doesn't necessarily have to be. And then it can be placed in a sealed envelope. So the point of this here is that there's confidential medical information. And even if you have a captain, ideally the captain really should have an awareness of all of the medical problems on board, because it really is important for him or her to know. But sometimes people don't necessarily feel comfortable sharing their confidential medical information with their friend with whom they're sailing. And that can be okay. It just has to be accessible. So we say, put it on a laminated single sheet, waterproof, in a sealed envelope. And then when it's needed, we can find it. I always like to tell people that you shouldn't assume, although we hope you never get into a situation like this, you shouldn't assume that you'll be able to communicate that information verbally yourself. And that's why it's so important that it be kept in an additional location and be accessible to everyone on the boat. If somebody is unconscious, they're not going to be able to share their, for either a medical or an injury reason, they're not going to be able to share their history with us. And so that has to be accessible to anyone on board. I would say, just kind of jumping back to the prior slides too, it's important that you see any specialists and just make sure that you have specific care plans for any problems that might arise out of medical problems that you have. So for example, if somebody is diabetic, they really should know that they have the supplies and the knowledge to at least initially manage a low blood sugar or a high blood sugar emergency. If somebody has a history of, for example, ulcerative colitis, they should know what their flares are like and make sure that they're carrying the medications that they would typically take, like a steroid, if they had a flare, if they're ulcerative colitis, and so on and so forth. If there are any questions about specific pre-existing conditions, I think, they could be shared with us through Corey, and that's something that we can talk about. But really the most important thing is that each individual person talk with their own doctor about what about their ability to go to sea, and what their sort of care plan would be if they have a common or known and anticipated issue with a medical condition that they have. That brings me to this, actually. Are you bringing medications or medical equipment? So everyone should be bringing some medications, and I'll talk about that in a little bit, but certainly you need to have supplies of your own medications. Make sure that you know what the expiration dates are, that you have them in waterproof containers, adequate quantity we already talked about. Medical equipment should be recently inspected. So if you have durable medical equipment on board, if you have anything that's specific, I'll talk about AEDs in a little bit, but some people might carry an AED, make sure that it's charged and been inspected. Make sure you have extra batteries for all of your equipment. Now, this is as simple as if you have an electronic thermometer, electronic blood pressure cuff, pulse oximeter, make sure you have batteries for those things. I also say, always bring an extra pair of glasses, and some people might have an extra pair of glasses, and it might even be worth bringing an extra pair of glasses. And then will these slides be shared after the webinar? This is being recorded, and I can also send a copy of the slides later. And then make sure that you have backup equipment. Okay, the other thing is communication, so that's important. So do you have a satellite phone? Make sure you know how to use it. Subscription is up to date. We do have some stories of people whose subscriptions have gone out of date while they're on the phone, while they're out at sea, or the bill hasn't been paid. Make sure you have a backup communication plan. And this probably doesn't apply to you all, but I kept it here anyway. There are some telemedicine kits that are out there, or some people choose to carry Bluetooth connected equipment like a glucometer. And so while it's not absolutely necessary to be able to connect all of that equipment to your sat phone or your Starlink, if that's something that you want to do, make sure you know how to do it before you leave shore. The other thing is just consider, I know that there are requirements for the Pacific Cup, but I just want to put in a point that it's important to consider taking a course on first aid at sea, wilderness first responder, EMT. There are a lot of options out there. And really, beyond medical care, there are safety courses, survival courses, firefighting courses, first aid courses. And then think about what training everyone on the boat has, right? So I always like to say that there shouldn't be a single point of failure with medical care. So if only one person has specific training, and that one person winds up becoming the person who's ill and injured, then sort of that person and everybody else on board is out of luck. And the captain really should know what courses his or her crew have taken and what special skills they have. I mention AED here because it's a question that really comes up every time I give either this talk or a similar talk, and it's actually very controversial. AEDs, I think everyone knows, these are automated external defibrillators that can shock the heart out of certain abnormal heart rhythms. And there's a lot of talk, terrestrial talk on land, about how effective these are in saving lives. And it's actually true. There's good evidence to show that when people have Cardiac arrhythmias in places like stadiums and airports where there are a lot of AEDs, they have higher survival rates. But there are really no studies that look at this at sea. And I think it stands to reason that part of the reason that survival rates are so much better with AEDs is that people can be shocked out of an abnormal heart rhythm and then taken to a hospital, generally speaking, and maintain a higher level and sort of get to a higher level of care where additional interventions can be done. If you're offshore, so I am aware of situations where AEDs have been used on boats that we've covered with good outcome close to shore. I'm not aware of any situations where this has really made a difference in outcome far offshore. And the reason it's controversial is because it's a very expensive item. They've certainly come down in price over the years, but it's unlikely to be used and it's very expensive. And I think that there's probably a higher likelihood of benefit putting that money into other things, like, for example, a good stock of antibiotics on board the boat than an AED. So I never tell people don't carry one, but I do tell people to really think a lot about whether or not it's worth it in comparison to where that money could otherwise be spent. All right, so special considerations. So eyes. I already mentioned dental care here, but eyes, teeth, and skin. So everything that's exposed. The other thing that we see an awful lot of across our practice is eye injuries. It really doesn't take long. It really only takes a second to have a little piece of rust go into your eye when you're grinding, or a chemical when you're cleaning. And people often don't really think about this, but it can really set you back. And the things that we divert ships for are life, limb, and sight. So if somebody's life is at risk, if somebody's is at risk of losing a limb, or if they're or function of a limb, or if they're at risk of losing their vision. And almost all of these are preventable. Certainly the injuries, almost all of the injuries are preventable. So I always like to talk about this in a little bit more detail. Make sure that you have eye protection on board. So sunglasses are important, UVA and UVB, but also think about what you're doing, right? Not all sunglasses are appropriate when you're swinging a mallet. And then not all safety glasses are appropriate when you're working with chemicals. And actually, when we do see injuries, when people are wearing some sort of eye protection, it is often the wrong eye protection. So, you know, I have a question mark behind welding because I suspect most people are not going to be carrying welders or carrying, carrying welding equipment on board. But, think about welder's glass versus splash protection versus shatter protection. And also eye protection for bystanders, because we do see bystander injuries as well. Teeth, I mentioned, you only have 28 to 32, depending on whether you have your wisdom teeth in or not, but get that dental work checked. And then wear sunblock too. We don't want to see sunburn. Let me pause here actually and just see if there are any questions that can be put in the chat, because I'm about to change and talk a little bit about telemedicine and how to contact us and interact with us. In the chat, how does one get prescription for antibiotics for general use while ashore? I'm going to talk about that as well. Actually, that's a great question. Thoughts about EpiPens? I do think every boat should have EpiPens. And I'm going to go through a list actually that we're going to provide this year of medications that we think you should have on board. So I'll come to that a little bit later in the presentation. But those are great questions. So telemedicine, what, why, and where? So I think over the course of the pandemic, we've probably all become a little bit more aware of what telemedicine is, but it's, fundamentally remote medical consultation. The traditional definitions are phone or face-to-face video, but we actually do a lot of, historically, because of bandwidth issues on ships, we've actually done a lot of care just over email. Very low bandwidth, sending pictures, sending emails. And I will say that you don't necessarily have to call us. You can actually, there are other ways to contact us. Why? I say ever been on an airplane because, even in 2 hours, sometimes people will have a medical emergency and there's not much there. And so, why we do this, it's to bring that capability to where you are. And then I say wherever you are. There is one little caveat, and that's licensing limitations. So within the United States, medical licensing is by state. Now, anyone who's offshore, we can take care of, we can provide care for. Across our practice, we have medical licenses in most of the coastal states. So I have where I live, DC, Maryland, Virginia, but I also have, New York, Washington, Texas, Florida, multiple states around the country. And our group of physicians we've set it up so that we have a patchwork to be able to cover the coastal states. But if you're in California or in Hawaii, like actually in port, we may or may not be able to treat you. That doesn't mean you can't call us if you're in one of those locations. So if you arrive in port and you have an issue, you can call us, but we may direct you to certain shoreside care resources. So we primarily are here to focus on when people are offshore. So how does this work? So you'll initiate a consultation with our communication center. We have a 24/7 communication center that's essentially dedicated to just maritime medicine and some of our other telemedicine programs. If you call us, a physician will join. We have multiple physicians who are dedicated to maritime on 24/7, and we'll consult with you. Now, as I mentioned, a lot of our care is via email. So if you send us an email, you can generally expect a response within about an hour. Sometimes we'll respond and say, if you're capable of calling us, please call us. Other times we'll respond with additional questions or recommendations. And then we'll make a treatment plan and review it with you. And that can sort of go one of two ways. We're always going to follow up. So let's say you have a minor issue. We think you have an ear infection. We're going to tell you to start taking an antibiotic. And then we'll follow up with you. Usually we do a first follow-up in 24 to 48 hours because that's when we are most likely to sort of see if anything's changing and see if we need to change our plan. Sometimes cases can go much longer, and then we'll continue following up on a predetermined schedule until the case is resolved. And resolution basically means that the case, the medical issue is resolved, or you've been transferred to a higher level of care, e.g., a shoreside hospital, or you've managed to be evacuated to a different ship. Every now and then we have situations where we think an evacuation or a diversion may need to happen. And in those cases, we always bring a second physician on board. Actually, in practice, it's often a conference between 3 or 4 or even 5 doctors. A lot of this comes from our history working with large commercial shippers. And as you can imagine, to divert a cargo ship costs tens of thousands of dollars a day. And so we really like to make sure that we've thought through the medical issue. I mean, our primary goal is the care of the patient. Just got a question. Do you have recommendations for antibiotics to cover most eventualities? I'm going to get to that. But we do often conference about cases. And then we also, as I mentioned, we have over 50 medical specialties available for specialty consultation if needed. I mentioned that we have a 24/7 call center. So this is our communication and operations hub for all maritime medical access services. It's staffed by EMTs and paramedics. So if you email or call, your first point of contact is going to be an EMT or paramedic who's going to forward your case to one of our physicians. And this basically provides instant access to client information. We have a custom built database of medical facilities that we refer to, that we build out as we have communication with hospitals around the country or around the world. We also have secure storage and management of medical and operational records. So we have a custom operational database, and we have a HIPAA compliant medical record as well. So if we're going to document your information, it's going to be a HIPAA compliant medical record. We can be contacted by phone, by email. We actually can receive faxes as well. We support several secure telemedicine systems, which I've demonstrated here, but I'm not going to talk much about those because those are generally used. They're expensive and generally used by commercial clients with high case volumes. All right, who's taking my call? I mentioned we're all board certified emergency physicians dedicated to the maritime program. So I will work, for example, one day in the emergency department, and then the next day I'll be covering maritime call. So we all are working routinely in the emergency department as well. We all have experience in maritime aviation or austere medicine. Our medical director actually was a former Coast Guard officer. And most of our group has either worked in the maritime industry or is involved in recreational sailing. Okay, what else do I need to know? So obviously I can't cover everything in a short webinar, but we have a 90-page communications and medical protocol manual. I basically just pulled out the cover, the quick reference sheet, and then the beginning of the table of contents. But this will be disseminated, available to you electronically, and I recommend everyone have a copy of this on the boat. It's sort of up to you if you want to print it and laminate it versus just keep it on a computer or a phone, but I would recommend being able to access this. At the very least, I recommend printing the quick reference guide out, because it kind of tells you what to do, when to email us, when you should definitely call us, and then how to get in touch with us. And so you want to be able to have that accessible. There are a few other pages in here. The page actually after the quick reference is an intake form, which you don't necessarily need to use, but it will give you a listing of the information that we'd like you to provide for us when you call, most of which I kind of already went over and should be on those laminated crew history sheets. Most of the book then also is divided into body systems. So, I don't know how, it depends on what size screen people are looking at, but like if you look at section 2, assessment protocols, second section, head and neck, ear problems. So if you had an ear problem, you would turn to page 20. It gives you a series of questions, which we would love you to sort of pre-fill out and send to us. And that helps us get information from you and helps us to communicate with you, and sort of gives you an idea of what information we need to be able to effectively communicate and develop a treatment plan for you. Then there's another section in this book that actually describes how to do medical procedures. So sometimes we might walk someone through something like, stitches or an eye exam. And so there's information about how to do those procedures already. It's not a comprehensive book that explains how to treat an illness or an injury. What we really want is for people to call us. Now, that said, we do recommend, although I don't have a specific recommendation, we do recommend that people have a good medical reference book on board. There are several that are sort of designed for this purpose, that sort of explain how to treat basic injuries, what antibiotics to use. Our preference always is that you call us and talk to us. There's no cost to you, and that's why we're here. But if you have communication difficulties, that could serve as a good backup. So that brings me to medicines and equipment. So this is a common question that we get. There's no single list. I've tried, and I'm going to share this with you, to put a list together for your race. But there's really no single list that's going to manage every injury or every illness, short of being at a hospital. And I can actually tell you that I can think of 2 times in the last year where I've needed medications in the emergency department in my hospital that we did not have in stock, and we had to go and call hospitals around the city to get them in. Certain poison antidotes, things that aren't used that frequently. So there's no facility in the world that can cover every illness or injury, but I have tried to put together a list for you. So recommended medicines, these are just categories, and I'm going to go into this in a little bit more detail, but analgesics, cough and cold medicines, gastrointestinal medicines, seasickness medicines, and then antibiotics. And I think antibiotics is perhaps one of the most important. People do get infections at sea. They get skin and soft tissue infections. They get pneumonia. I mean, we've actually seen things like meningitis and spinal abscesses. I mean, those are rare. Again, we can't cover every eventuality, but certainly the common infections, diarrheal illnesses, these are common. And sometimes just having an antibiotic on board can be the difference between taking a medicine for a few days and getting on your way, and versus getting really sick and having to be evacuated. Medications can be expensive. although not that expensive actually. And I think sometimes people think, well, why would I want to get this pill that I might not need, that's going to expire, and I'm ultimately going to have to throw it out? But, what I always tell people is, you wouldn't sail without an EPIRB, you wouldn't sail without a life raft. I mean, these are also expensive items that you really hope and that most people never really will need, but still are very important. And I think having a list of antibiotics on board, or a stock of antibiotics on board, really should fall into that category. And then there are various categories of diagnostic equipment for scrapes, cuts, burns, fractures. I'm going to stop sharing the slideshow for a minute, and I'm actually going to share the list. Now, this list, it either is already or will be shortly on the RACE website. Just give me a moment. Okay, now, before I share this, I just want to reiterate that this will be on the website. So I will kind of go through the categories. I want to talk a little bit about antibiotics, but I don't want everyone to focus too much on trying to read every word of this, because it's a 5-page document of text. And so, of course, it's not all going to come through in a presentation. There's a little bit of a preamble sort of describing what the equipment is, but I'm going to get right into the medications to carry. And I want to talk about this just so that I can talk through it and you can see it before you go and download it yourself. But I've divided it up into anti-infectives, analgesic medications, gastrointestinal medications, cough, cold, allergy, and respiratory medicines, dermatologic medicines, and seasick medicines. Medications that are prescription have the little red RX next to it, and I've put I haven't listed detailed indications for each of these, and the reason is because it can get actually quite complicated, because several medications can be used for the same type of infections but different subcategories of those types of infections. So this document is really not designed to be a list of what you should use in any specific situation, just a list of what we would recommend you consider carrying. And I don't necessarily think you absolutely have to have every item on the list. I think it's important to talk about this with a medical professional, to think about things that you might not need. For example, I'm just looking at this. If there are all men on the boat, you don't need to carry miconazole for yeast infection. Most of these items are over the counter. You can go to your drugstore and just kind of pick them up without a prescription. I'm going to talk about antibiotics here. So I've tried to reduce it. So if you could only carry 4 antibiotics, I would carry the first 4. And I really do recommend carrying the 5th as well, even though it may not be used. So this is a list of about 5 antibiotics. The cash cost for all of these antibiotics together, one course of all of these antibiotics together, I don't have it directly in front of me, but it would probably be a few $100s. So Caflex, doxycycline, azithromycin, ciprofloxacin, and then metronidazole. The next few are items that are perhaps more optional. So diflucan is an oral antifungal that would be used for also certain types of yeast infections. And then valacyclovir is very specifically an antiviral that is used for shingles. Now, shingles can happen in any age group, any person, anyone who's previously been infected with the chicken pox, which is probably most of us. But it's worth having a discussion about your doctor. If you're young or middle-aged, you're probably not in a high risk, group for shingles. And then some people have had the shingles vaccine, which is not 100% efficacious, but significantly reduces the likelihood of having gotten shingles, or the likelihood of getting a shingles infection. Then we have erythromycin ophthalmic ointment. As I mentioned, we do see a lot of eye infections, so that's an antibiotic. And then we have ciprofloxacin ophthalmic drops. So that's an eye drop for eye infections, and specifically for people who wear contact lenses. The other thing about the ciprofloxacin eye drops is that they can actually be used in the ear. So I have not put any eardrop antibiotic on here specifically because I think it's a cost saver. The eye drop can be used in the ear, but the eardrop cannot be used in the eye. And then just a topical over-the-counter antibiotic. So this sort of list of this first 5 is really kind of the minimum that I would recommend. Now, there are a few other, I'm going to go through this here actually and mention that there are a few other prescription medications. If there's one other prescription medication that you should definitely have, it's ondansetron or Zofran, which is a very, very effective anti-nausea medicine. And then the other category of medicines, so there are a few sort of respiratory and allergy medicines that are prescription. So an albuterol inhaler, some prednisone, which is a steroid tablet, and then somebody mentioned an EpiPen. I do recommend, certainly if anyone has a known history of allergies or anaphylaxis, they should be carrying EpiPens, but I do recommend that every ship carry two. They come in a 2-pack, typically, a box of EpiPens. Getting antibiotics. So there are a couple of ways to get antibiotics and prescription medication. So one option, some doctors still, I think a generation ago, this was actually a lot easier. And, just as a quick side note, this actually is a problem across the industry. It's a very legitimate use for an individual on their boat to carry a stock of medications, of prescription medications, and even in some cases, opioid medications. But the prescribing laws are such that it is very challenging for individuals and even some large vessels to get these medications. So a generation ago, it was a lot easier to go to your physician and just, ask for some prescriptions and go to the pharmacy and fill the prescriptions. And if you have a physician who's trusted, who's willing to do that for you, that's kind of your first option. And it's not a bad option. You can use your insurance to pay. The next option would be to use a commercial service that will provide prescriptions. So the one that I'm actually going to recommend to you all, although it's not in this document, is Duration Health. And we have a developing relationship with them, and they've actually indicated that they would put together a discount code for you all, which I will share with the committee hopefully within a few days. But Duration Health, basically, if you want to take a look at their website right now, you can. They are a company that effectively is a medical practice that allows you to do a consult with them, and they will essentially prescribe and ship you these medications at cost. And so essentially it's a cost to purchasing a kit with prescription medications. And I highly recommend them as an option. There are a few others out there that you can look into that will provide a similar service. There are also there are large commercial pharmacies that deal with the maritime industry. So Universal Marine Medical is one, although they deal mostly with large commercial clients. And then there's one in the Pacific Northwest that we use a lot called Lafferty's EMS. And so these resources are out there to essentially be able to just purchase medications for legitimate use. But I would say that for most folks on their own boat, single-handing or double-handing, either speaking with your own physician or going to a company like Duration Health and essentially purchasing a kit of prescription antibiotics is probably the best way to do this. And then everything else on here, like I said, can be purchased kind of over the counter. There are a few things that I want to mention. So I have an other medications to consider section. So if there's a sailor with diabetes on board, and I call out diabetes specifically because it is a very common condition in our society. It is worth considering having other items on board like oral glucose or a glucagon kit. So a lot of people with diabetes may already carry like intranasal glucagon or even intramuscular glucagon injections. But if someone with diabetes, and actually, if somebody is going to be on your crew and they have diabetes, their own endocrinologist will almost definitely prescribe them some sort of glucagon. So that's not something that you should have to go that far out of your way to get. The other thing is anti-seizure medications. So I think going to sea with a known seizure disorder, if it's not well controlled, probably shouldn't be done. If it is well controlled, it's something to consider, just making sure that the individual has their own seizure medications. But when we do recommend carrying a seizure medicine in the ship's stock, we recommend Keppra and also lorazepam, which is Ativan. This is a medication that's a benzodiazepine. It's kind of in the same family as Valium, which I think a lot of people are familiar with, but it can be injected to stop a seizure. It is the only controlled substance on the list. And it's as a controlled substance, a company like Duration Health won't supply it. So it's something that would have to be obtained from one's own physician. But if somebody is going to be sailing on your boat and they have a known seizure disorder, you really should consider telling them or asking them to obtain a seizure aborting medication such as Ativan from their physician. And actually, there are rectal gels as well that sometimes people will use to stop a seizure. I do want to call out this note about cough and cold medicines. You can read this if you'd like, but basically the point that I want to make is that a lot of the over-the-counter cough and cold medicines are combination products. So they'll have, a decongestant, an antihistamine, an analgesic, or an antipyretic like Tylenol or ibuprofen. And now we're seeing pills that have both Tylenol and ibuprofen in them. It is actually fairly easy to overdose on some of these medications. Tylenol in large quantities can be very dangerous, but more acute, it's rare even with combination products, but more acutely, people do overdose on cold medicines by accident, or some of the cold medicines will interact with some of the seasickness medicines, and they can be synergistic, and they can cause kind of acute changes in mental status, urinary retention, other various symptoms as well. And so whenever people carry cough and cold medicines, what I actually recommend, although they're harder to find, is to pick up the different boxes and buy the medicine that just has Tylenol, or the medicine that just has guaifenesin. So instead of one of the Mucinex combination products, or just has dextromethorphan in it. And that way we can tell you what to take, and you can certainly take them all at the same time, but you don't run the risk of accidentally taking, 2 different pills that have the same medication and then overdosing. And then the second part of this document, essentially all of this is over the counter, but just talks about what diagnostic equipment to carry, what personal protective equipment to carry, diagnostic tests, and then, basic tools, basic first aid tools. I think there's no problem with picking up an off-the-shelf first aid kit, especially one that's geared toward the maritime industry. There are plenty out there that are pretty well stocked, or you can sort of do it yourself. Sometimes people will go to Amazon and purchase products off of Amazon. And I think for the most part, while in some cases you don't necessarily know what you're getting, you can actually save a lot of money by buying in bulk, or from buying more generic brands. I think I actually personally find this funny that pregnancy tests are important to be on the boat if there are females of childbearing age. That's the first thing we would ask for if there's abdominal pain. But I think that it's interesting that you can go to CVS and pay, I don't know, $15 or $20 for 2 pregnancy tests, or you can go on Amazon and buy the same pregnancy test that we use in the hospital and get 100 of them for $10. So there are definitely places where you shouldn't overspend. Let me stop here and see if there are any questions about this list. I got a question. Let me just read it real quick. So I'm going to genericize this question, but it's basically a question asking about whether there are any particular concerns for mental health medications. I would say that if you're not traveling international, which you're not, there are really no specific concerns around carriage of these medications. So there are some countries where certain ADHD medications are illegal and you don't want to bring them into the country. In this case, since there's nothing international, there shouldn't be a concern about carrying those medications. The one thing that I will call out, though, is that if you have a crew member on board who has a history of depression, anxiety, ADHD, there's absolutely no problem with those individuals sailing with you, but it goes back to making sure that they have communicated with their specialist or their psychiatrist or primary care doctor, and make sure that they have been stable for like a good long period of time on their medication, for at least a period of 3 to 6 months. somebody who's actively titrating medications up or down probably should not be sailing on a short sail while they're undergoing medication changes. And that really works both ways. So there can be side effects when some of the antidepressants are up titrated. And actually, we've seen this. I feel like if it's asked, we've probably seen it. And we've also seen scenarios where people have had withdrawal. So certain antidepressants like SSRIs can have pretty significant withdrawal symptoms. And we don't want to see people withdrawing. What we tell people in the commercial world, if you're going to be titrating off a medication, is make sure that you have different doses of the medication so that you can titrate appropriately. But that really shouldn't apply here. I hope that answered your question. And if it didn't, then feel free to reach out after this. I have another question. Does it make sense to learn to insert an IV? And if so, how do you do that? So I wouldn't go out and recommend that people specifically learn how to insert an IV. It's actually rare that we need to recommend that people start an IV. It requires having IV start kits and IV fluids. I've specifically not included any IV medications on this list. The only scenario where it would really be needed is if somebody is having nausea and vomiting so severe that's not controlled by one of the medications on the list, that they become very dehydrated. And that actually can become quite dangerous. And that's the situation where we would want someone to start an IV. I really can count on one hand the number of times I've asked somebody to start an IV on a ship in the last year and a half, or really 2 years. The other thing is, it is a special skill. It can be learned by anyone, but you really have to go through a course to learn it, and then you have to practice. Even somebody who learns that skill and does it on a practice arm, to really be proficient at it, you have to do it over and over again. So I don't recommend that it's need to be ordered. Someone says, sorry if I missed this issue, but are suppositories appropriate for serious seasickness cases? They are actually. I did not include any suppositories on this list, largely in the interest, and there are also intramuscular medications that can be used for really serious seasickness cases. I didn't list any of those, so Compazine as an example, on this list because primarily for like cost and simplicity reasons. So the seasickness medications on the list, plus the prescription Zofran, in almost all cases, Zofran is a tablet that dissolves in the mouth. It's an oral disintegrating tablet. In almost all cases are sufficient. I do think that if you have genuine concern, it's certainly reasonable to carry suppositories if desired. Can you explain for which infections the first 5 antibiotics you recommend are used? Yes. So this gets a little complicated, and I actually, in an earlier iteration of this list, kind of had some indications, but it became very complicated very quickly because, for example, Paflex, doxycycline, ciprofloxacin, they can all be used for skin infections. Azithromycin can be used for pneumonia. Doxycycline can be used for pneumonia. Ciprofloxacin and metronidazole can be used for intra-abdominal infections. The thing is that we would select a different antibiotic or combination of antibiotics depending on what your exposures are. So for example, some medications cover MRSA, methicillin-resistant Staph aureus. Some cover Vibrio species, which are found in salt water and cause some flesh-eating, layman's terms, flesh-eating infections. So this kind of set of antibiotics is actually designed to cover most of the infections that we're going to see on board. So this is going to cover your sinusitis. This is going to cover your pharyngitis. This is going to cover cellulitis, abscesses, other skin and soft tissue infections. You're going to be able to cover pneumonias with this. We're going to be able to cover things like so intra-abdominal infections, things like diverticulitis, appendicitis. So obviously the treatment for appendicitis, if anyone developed appendicitis, would be surgery, but we would still start you on an oral antibiotic. Cholecystitis, so a gallbladder infection. This will also cover your urinary tract infections. Metronidazole will cover certain types of vaginal infections, so that's another reason why it's very useful. I think that probably covers the list of the most common types of infections that we're going to see. But there really are tens of antibiotics that we use routinely, and there are hundreds of antibiotics overall. And so we kind of designed this list to be able to empirically treat the most common types of infections that we'll see, covered by the most common types of organisms, bacteria, fungus, or viruses with fluconazole and Valtrex. And then, but there are things that this list won't cover, but it will cover the most common infections from the most common organisms for probably the cheapest amount of money and the least number of items carried. If that makes sense. Scopolamine patches, I do have that on here actually. Someone asked scopolamine transdermal patches. Yep. And I do recommend them. They work very well. That's actually another item that an individual probably can get prescribed by their own primary care doctor as well. So it's 10:30, or in my time it's 10:30. I have a little extra time, but your time it's 7:30. But I'd like to move on. How long after the race will we have access to this service? So let me talk about that. I do actually talk about that, and I'm going to kind of finish up my slides here. So when should I call? When is someone sick enough? Does it make you nervous? Does it impact the mission? We always say call early, call often, and no issue is too small. I would much rather
Dr. Rittenberg, I think we're
Yeah.
still on the equipment list.
Oh, sorry about that. Hold on. Let me switch my slides back. I always say that I would much rather have you call and find that there's not a major issue than that you not call and that something then becomes a major issue. How often should you call? Whenever you need to. And we will set up communication schedules. If you open a case with us, we'll tell you to follow up in 24 hours. And we will actually reach out as well. So if we don't hear from you, we'll send an email that says, hey, can you please provide an update? Dates of coverage. Okay, so the coverage, and I guess I'll leave the details of this sort of up to the race committee, but what we've done is we've contracted to cover all of the racers during the race. And then for those who are returning, there is an option to extend at an individual's cost. I will say that we are happy to cover you for as long as you'd like. So if you race and you get covered on the return, but you're going to be sailing for the rest of the summer, please reach out to us because we'll be happy to individually contract with you to provide this service on an ongoing basis. Length of a call as long as you need. Typical calls, injuries, medication questions, feigning abdominal pain, fever, really anything that you need for us to cover. Feel free to contact us. I would ask, I've put my individual email up there. You may get a response from me if you ask a question, but I would ask that people funnel questions up through Corey or through the race committee and to send to me sort of in the aggregate so that I am kind of communicating back with one individual. If I get 30 emails, it'll be difficult for me to kind of get through all of them. But I think we've hit the end of the hour. Let me see if there are any other questions for now. Okay.
I think there are a few things in the chat.
Oh yeah. Talked about the top 5 antibiotics. Okay, is there a seasickness medication that is shown to be effective after symptoms develop? So all of the seasickness medications are more effective prior to the development of symptoms, but they all also work after. We will still recommend that they be used after. And then someone's mentioning sturgeon. I don't know literature specifically, but something to consider. There are a lot of papers about this, and a lot of the medications are variably effective in different people. So some people will find the medication that works for them and say that other medications don't work, whereas other people will find, medication be very effective for them. I think that's it. Corey or Bob, any closing comments?
Yeah, thanks for answering all the questions. I did post my email address in the chat if people want to send questions that they think of later to me, and I can compile them, and either we can make sure that the answers go to just you, or we can share them with all the attendees. We will post the recording of this session. So if you know people who weren't able to make it, or you want to watch it again, you can view that, and we'll send out an email when that's available. Otherwise, thank you so much, Dr. Rittenberg. I know that, this service has literally saved people's lives during Pacific Cup races and returns, and it's really great to know who to call when you have these problems. I was doing the Transpac last year, and somebody fell and had a head injury, and we didn't have GWU, so we had to think of a doctor that we knew to call. And then we had to coordinate with the Coast Guard on our own separately from our medical professional. And the stories I've heard of people on the race talking with GWU are just really great. And they've been super, super awesome. So
Thank you. I appreciate you saying that. I know that we covered some individuals who reached out to us individually before the Transpac. And so if you have a connection at the race committee, and we'd be happy to extend the service to the Transpac too as a group. But I appreciate your kind words.
great. Well, thank you, everyone. And we will send you the follow-ups. And thank you again, Dr. Rittenberg. Have a good
You're
night.
welcome. Yeah, take care. Bye-bye.